Hi everybody, welcome to Dr. Manny's YouTube Learnshops. Today we're going to be discussing human growth, the developmental stages, concentrating on the fetus, the newborn and childhood. The learning outcomes for this session are that you'll be able to list the periods of childhood development, comprehend newborn infant behavioural capabilities, be able to discuss factors that impact on development, or certainly identify factors, state the 5 spheres of childhood development, and understand concepts related to temperament and attachment. Okay, let's look at a definition of what childhood development means. It involves biological, psychological and emotional changes that occur in all human beings from the time they're born to the end of adolescence, after which they're considered to be adults. It occurs in specific stages and it follows a systematic pattern, and it progresses towards greater complexity which enhances their survival. All human beings progress from dependency to independence or autonomy. It involves gross motor skill development, fine motor skill development, speech and language development, social and emotional development, and cognitive development. Let's look at the periods of development. Human development is a predictable process that goes through specific changes: infancy, childhood, adolescence, and adulthood. In infancy, we rely on others to meet our needs as we begin to gain control over our bodies. In childhood, we begin to develop a sense of independence and learn what we can and what we cannot do. Childhood development then is the process of maturation that includes infancy, early childhood, middle childhood and adolescence. And we've already looked at lots of theories in the field of child development, which included Freud, Erikson, Bandura, and so on. Prenatal is conception to birth. Infancy and toddlerhood, birth to 2 years of age. Early childhood, 2 to 6 years. Middle childhood, 6 to 12 years. Adolescence, 12 to 19 years. When we look at prenatal development, we first look at the germinal stage. And the germinal stage is a stage of development. It's the first one and it's the shortest stage of human lifespan. It lasts approximately 8 to 9 days, beginning with fertilization and ending with implantation in the endometrium of the fetus, after which the developing organism is called an embryo. It's the first 2 weeks after conception, rapid cell division, migration of an implantation into the uterus, and a placenta forms. In prenatal period, the next stage is called the embryonic period. And the embryonic period typically comprises of approximately 56 days, 8 weeks from the moment of fertilization. In biological terms, it's the development of the human body which entails growth from one-celled zygote to a newborn human being. And there are 23 specific stages. These are the Carnegie stages of human development, just one of many. And it was based on the work by Streeter in 1942 and O'Reilly and Muller in 1987. And the name Carnegie stages comes from the Carnegie Institution in Washington. Then comes the fetal period. And the fetal period is the period of development from the 9th week until you're born. The fetal period is the introduction of the development of the embryo to the fetus, and it's not abrupt, but the embryo changes to a recognizable human being and develops all the basic outlines of organs, after which it is called a fetus. The process of prenatal development occurs in 3 main stages. The first 2 weeks after conception, we already said, is the germinal stage. The 3rd through the 8th week is known as the embryonic period, and the time from the 9th week until birth is known as the fetal period. And this is when our organs, our physical structures develop. For example, the eyes typically are developed in the 4th week to full term. Heart, the 3rd to the 9th week. The lower limbs, the 4th to the 9th week. The external genitalia, the 7th till your full term. Your central nervous system, the 3rd to full term. Ears, 4 to 20 weeks. Teeth, 6 to full term. You don't see them, but they're there. The palate, 6 to 16 weeks. The upper limbs, 4 to 9 weeks. Specific stages. Concepts related to human development are that it's a continuous process from the time of conception to maturity. It commences in utero, in the uterus. Birth is an event in the course of the development. Order of development is similar in all children. The rate of development does, however, vary from child to child. We're individuals. Newborn behavioural capabilities include the body position. In the first few weeks, newborns continue to maintain the position they had in the womb, the fetal position. Clenched fists, bent elbows, hips and knees, arms and legs close to the front of the body. This is, as I indicated, the fetal position. Newborn behavioural abilities also include breathing. It's not uncommon for newborns to experience or demonstrate irregular breathing. This is where newborns stop breathing, apnea, but not for more than 5 to 10 seconds. Then breathing begins again. If apnea is longer than 10 seconds, or the infant turns blue, cyanosed, this requires care in an emergency department. They need to be seen by a physician. They need to be seen by a paediatrician. Newborn behavioural capabilities in relation to their vision. Their eyes may be crossed. This is referred to as a strabismus. They will be more aligned as they get older, as their oculomotor muscles develop. They can see movement and contrast between black and white objects. At approximately 2 to 3 months, babies do have more control of their eye muscles and are able to focus on a specific thing. And they can also follow objects. Their hearing. They can distinguish between different sounds. They can recognize familiar voices. So you should talk to your baby often. Language sounds like music with different tones and rhythms are complementary. Remember, when your baby, the fetus, is in utero, they can hear things as well. Newborn behavioural capabilities in relation to sleep. They sleep 20 minutes to 4 hours at a time, up to 20 hours a day. Their stomachs are too small to keep them full for long, which means they get hungry. So they need to be fed every few hours. Babies all have different sleeping habits, but typically at 3 months, most babies sleep 6 to 8 hours a night. Babies cry. When do they cry? When they're hungry, tired, cold, hot, need their diaper changed, need comfort, have colic, overstimulated, don't feel well. Physiological needs. They need to be met. Newborn behavioural capabilities. Let's look at some of the reflexes. Reflexes for newborns, they have several natural or primitive reflexes. And understanding these reflexes will help you understand the cause of some of the newborn's behavioural issues. Let's review some of the normal newborn reflexes, the primitive reflexes. Primitive reflexes are the first part of the brain to develop and should only remain active for a couple of months after they're born. Retained primitive reflexes can lead to developmental delays related to disorders such as attention deficit hyperactivity disorder, sensory processing disorder, autism, and learning disabilities. Now, we're only going to cover some. If you want to look at more, you can look at more. The most common ones are the rooting reflex, the sucking reflex, the Moro reflex, the tonic neck reflex, the rasp reflex, the step reflex, and the Babinski reflex. The rooting reflex is a reflex that is normally seen in newborn babies, normal newborn babies. And they automatically turn their face towards the stimulus and make a sucking, rooting motion with their mouth when the cheek or lip is touched. The rooting reflex is essential and it helps to ensure successful breastfeeding. So, this reflex occurs when the baby's cheek is stroked as it's coming in contact with its mother's breast, and the infant will turn to the side that was stroked and begins to make sucking movements. This typically disappears at the age of 4 months. The sucking reflex. That's probably one of the most important reflexes that a newborn has. It's paired with the rooting reflex, in which the newborn searches for a food source. And when he finds it, the sucking reflex allows him to suck and swallow the milk. It disappears typically at the age of 12 months. The Moro or Startle reflex is an infantile reflex that develops between 20 to 30 weeks of gestation and disappears about 2 months, but typically 3 to 6 months of age. It's a response to a sudden loss of support and involves 3 distinct components: spreading out of the arms, abduction; pulling the arms in, adduction; and crying, usually. So the reflex only occurs when the infant is startled by a loud noise, for example, or a bright light. It's characterized, as I said, by extension of the arms, legs away from the body and to the side, and then by drawing them together as if in an embrace. Typically it disappears, as I said, by 2 months, but it can last 3 to 6 months of age. Then you've got the tonic neck reflex, and this is also referred to as the asymmetrical tonic neck reflex, ATNR. And it's a primitive reflex that's found in newborn humans, and it normally disappears at around about 6 to 7 months of age, 5 to 7 months of age. It's also known as the fencing reflex because it looks like the infant's arms and head are put into a position that's classically for a trained fencer, someone who fights with a sword. So this reflex occurs when the head is relaxed, lying face up on the side. The arm and the side where the head is facing reaches away from the body. The hand is partially open. The arm on the side away from the face is flexed and the fist is clenched tightly. As I said, it's referred to as a fencer's position. The grasp reflex, also known as the palmar grasp reflex, is a primitive reflex found in infants of humans and, interestingly enough, most primates. When an object's placed in the infant's hand or palm, or they're stroked, the fingers close reflexively and the object is grasped by the palmar grasp. This reflex occurs, as I said, when an object or a finger is placed on the infant's open palm or even the sole of the foot. The palmar grasp disappears at approximately 5 to 6 months. The plantar grasp disappears at about 9 to 12 months. The grasp reflex. Then you've got the stepping reflex, stepping or wharfing reflex. And this reflex occurs in stepping motions when the sole of the foot touches a hard surface. It's present at birth, and though infants can't support themselves walking with their own weight, as I said, when the soles of the feet touch a flat surface, they will attempt to walk by placing one foot in front of the other. It typically disappears at approximately 2 months of age. The stepping or walking reflex. The crawling reflex is another primitive reflex. If you place the baby on their stomach, they'll pull their legs under their body and kick them out in a crawling motion. In fact, when newborn babies are placed on their mother's stomachs, really their abdomens, they crawl up to their mother's breast, or try to, and start suckling. When a baby is placed prone or on their abdomen, they pull their legs under their body, kick them out in a crawling motion. This typically disappears at 1 to 2 months of age. The crawling reflex. The Babinski reflex is one of the normal reflexes in infants. The reflexes are responses that occur when the body receives a certain stimuli or stimulus. The Babinski reflex occurs after the sole of the foot has been firmly stroked. The big toe moves upward or toward the top of the surface of the foot. The other toes fan out. So this reflex occurs after the sole of the foot has been stroked firmly. The big toe moves upward or towards the top of the surface of the foot. The other toes fan out. This is a normal reflex seen in children up to 2 years of age. However, it can disappear between 6 months of age and 2 years of age. This is a normal primitive reflex. Let's review developmental milestones. What are milestones? Well, milestones, developmental milestones, are behaviours or physical skills that you see in infants or children as they grow and develop. Rolling over, crawling, walking, talking, they're all considered developmental milestones. And milestones are different for each age range. However, there are normal age ranges which a child may reach for each milestone. And they should, otherwise there could be a problem with their development. At the age of 1 month, the infant should be lifting its head, moving its head from side to side while lying on its abdomen, prone, crying for needs and responding to sound. At 3 months of age, hearing and vision are already improving. Babies at this age turn their heads and smile at the sound of their parent's voice. They love listening to all kinds of music. Your infant will also gain intently at their own reflection in a mirror. They hold their head, they smile, they laugh, they visually track moving objects, they open and shut their hands. At the age of 6 months, they roll over in both directions, typically. They imitate sounds. They turn to sounds, voices. They may or may not sit up. They could. Some babies can propel themselves forward around on the floor using a rolling method. Some babies can rise up on their hands and knees, rock back and forth. They're becoming more ambivalent. They may or may not be able to sit up. At the age of 1 year, milestones include gross motor skill development. This is using big muscles to move the whole body. Or fine motor skills, using smaller muscles for little things. Most 1-year-olds can sit without leaning on anything or being held. They can belly crawl on their abdomen, scoot or creep on their hands and feet. They can gesture with wants or needs. They know more than one word. They can imitate others and they can walk. Typically, they may be able to walk at 1 year of age. Now let's look at what developmental percentiles are. Well, what are they? Well, a percentile, in everyday use, there's no real definition for it, but the most common definition of a percentile is a number where a certain percentage of scores fall below a number. If you know the score is the 90th percentile, that means you scored better than 90% of the people who took the test. You'll learn about these when you do research as well. But in pediatrics, percentiles are very, very important. Most children would be closer to the 50th percentile, so that if your child is above the 97th or below the 3rd percentile, he's part of a small group of people. As long as your child or the child stays within a personal growth curve, whether this curve is under or above the 50th percentile, then development is normal. Most children, most infants fall within the 50th percentile. Let's look at one percentile to give you an idea. This is for girls, weight for age, birth to 2 years, percentile. Percentiles are the measurements that show where a child is compared with others. Normal or not normal. As we said earlier on, the 50th percentile, the green line curve, is typically where normal children, infants, at a specific age are located. So for example, when doctors plot a child's weight and height on a chart, they see which percentile line those measurements land on. If the child's weight is at the 50th percentile line, typically most are normal, that means out of 100 normal children, the child, 50 will be bigger or 50 will be smaller. Body mass index is also a calculation of the child's weight. So for example, a BMI above the 85th percentile means overweight, while children above the 95th percentile are considered obese. The closer they are to the 50th percentile, the closer they are to being normal. When we look at the spheres of development, there are 5 interrelated areas of childhood development. You've got the cognitive development, and this is the child's ability to learn and solve problems. You've got social and emotional development. You've got speech and language development. You've got fine motor skill development. You've got gross motor skill development. These are the spheres of development, and they all interrelate with each other. When we look at physical and motor development, we've got 2 major areas: gross motor skills and fine motor skills. And basically, motor skill development means physical growth and strengthening of the child's bones, muscles, abilities to move, touch the surroundings. So for example, if a child's able to crawl, walk, that's gross motor skills, then they can more easily explore their environment. If you can brush your teeth, comb your hair, get dressed with a little bit of help, use eating utensils, child side of course, scissors, cut along a line, pick up small items such as coins, toothpicks, paper clips, assemble simple puzzles, copy simple shapes. This is fine motor skills. When we talk about cognitive development in early childhood, this refers to the infant or toddler's mental capabilities for problem solving, language acquisition, learning about objects, the relationships between cause and effect. This is remembering. This is problem solving. This is decision making. Putting together puzzles, fine motor skills. Cognitive development. Problem solving. The third is language and speech development. Now this is a critical part of the child's overall development, and it supports their ability to communicate and express and understand feelings. In the first 12 months, babies develop many foundations that underpin speech and language development. It's the first signs of communication. When the infant starts to cry, because it then sees that crying will bring food, comfort and companionship. Newborns also begin to recognise the importance of sounds in their environment, such as the voice of their mother or their primary caregiver. So the first 12 months of a baby's life is where they develop the bases that reinforce speech and language development. They realise that it's the first signs of communication. When they cry, someone's going to bring them food, someone's going to comfort them, someone is going to come to them. they want their bottle, they want their food. The fourth is about social and emotional development. And this includes the child's experience, expression and management of emotions, their ability to establish a positive and rewarding relationship with others. Chronologically, this is the period of infancy from the first to the second year of life, and the child, well handled, nurtured, loved, develops trust, security and a basic optimism. If it's badly handled, they become insecure and mistrustful. Not unlike the trust and mistrust from Erikson. In this stage, you love your child, you show them affection, you hug them, cuddle them, read to them, talk to them. You encourage the child to try new things. You give the child opportunities to play with other children their age, show their feelings, establish routines, and you acknowledge your child's feelings in this stage. Reading to them, they learn language. Talking to them, they learn language. Emotional development, trust versus mistrust, as Erikson said. In social development, there's also an element of attachment. Attachment, according to John Bowlby, who was a psychoanalyst like Freud, he believed that mental health and behavioural problems could be attributed to early childhood. Bowlby was in the period 1907-1990, he died. And this is now an attachment, being an emotional bond that develops from the time of birth to the parents or the caregiver. Babies form an attachment, bonding, through a gradual process that begins from birth, as I said, through to early childhood. Newborns have a powerful social signal. They cry, and this should bring care and sympathy. If it doesn't, it can be a problem. Social smiling prompts joy and pleasure from parents or caregivers. Examples of development include social smiling and laughing at about 4 to 6 weeks. Surprise and sadness at about 3 to 4 months. Fear, shyness at about 5 to 8 months. Guilt at approximately 2 years of age. John Bowlby, he was a British psychologist, psychiatrist, psychoanalyst. He coined this term attachment, and he came up with what was called attachment theory. And he, like Freud, as a psychoanalyst, believed that mental health and behavioural problems could be attributed to early childhood. And he basically stated that there were 4 basic characteristics that give us a clear view what an attachment really is. And they include having a safe haven or place, a secure base, proximity, maintenance, and separation distress. And these 4 attributes are very evident in the relationship between a child and their parents or their caregiver. So, a normal developing child, he said, will develop an attachment relationship with any caregiver who provides regular physical and emotional care, regardless of the quality of that care, children develop a hierarchy of attachments with various caregivers. The attachment styles are secure or they can be insecure. If they're insecure, they're avoidant-insecure, ambivalent-insecure, and disorganized-insecure. If they're secure, they're content, they're engaged. If they're avoidant, they're withdrawn, they're quiet, they're anxious. If they're ambivalent, they're anxious, not focused, insecure, and they ask a lot of questions. If they're disorganized, they're angry, they're depressed, they don't follow directions, they have a short fuse or temper, they have difficulty making friends. Let's review. So what's secure attachment? It's a trusting emotional bond. The infants use their parents as a safety net or base. They tend to explore environments as long as their parents are somewhere in the vicinity and don't get upset. When a parent who has left the vicinity returns, they typically greet their parents positively, and if they were upset, are very easily calmed. It develops trust in people. A secure attachment promotes trust. These infants and children deal with stress better. They grew up to be more positive. They have coping skills. Secure attachment basically equals trust. A lot like Erikson's first stage, trust versus mistrust. An infant or a baby, for example, if they're crying, the needs are met, trust develops. They're too busy doing something else. The cares are not met by the caregiver, mistrust develops. Erikson's first stage as well, very similar. Let's look at ambivalent or insecure attachment. And this can also be called anxious, resistant, insecure attachment. And it's more common in children whose parents are unreliable. Sometimes they're present, emotionally and physically, and sometimes they're not. Children often present as being highly anxious and they don't trust people. Trusting people is difficult. Look at the image. Very cute. It's harder for someone who is raised in this attachment style to trust and believe that loved ones will follow through or remain true to them. In general, a child with an anxious, resistant attachment style will typically explore very little in a strange situation. They're very wary of strangers, even when the caregiver is present. Avoidant-Insecure Attachment. A child with avoidant or anxious insecure attachment will avoid or ignore the caregiver, show very little emotion when the caregiver departs or returns, couldn't care less. The child will not explore very much regardless of who is there. Avoidant attachment is a form of attachment characterized by children who learn to avoid feeling attachment towards their parents or caregivers. They learn it. And therefore they don't attach well to other individuals. So the avoidant insecure attachment child has parents who are consistently not there. They're not present. Or they were dismissive. They could be there physically, but they're not there emotionally. They experience a world as a place where others cannot be relied on. As adults, they become fearful of closeness or intimacy. They're fearful of being hurt and feel natural need to protect themselves. Yeah, it's sad. As parents, they may have a hard time understanding or connecting with their children. The final attachment style, disorganized-insecure, this is where caregivers are scary. They're inconsistent and they often have frightening behaviours which can involve physical abuse, psychological violence. The children who grow up in this type of environment struggle with relationships all throughout their life. They don't learn healthy, fair parenting or nurturing, and may actually become their parents in the way they provide care for their children. On one hand, they want to be close, but on the other hand, they can't be. It's really sad. Disordered or insecure attachment. So let's review class activity. You can think about these things. As I said, I'll think about it and post some sort of things. What are the two main types of attachment? Think about it. You should be able to explain ambivalent-insecure attachment, avoidant-insecure attachment, disorganized-insecure attachment. And what are the effects of secure and insecure attachment? Remember, secure attachment, they develop more trusting, enjoying relationships more. They deal better with stress. They grow up to be more positive. They cope better with stress. Insecure, they're not independent. They have poor social relationships. They do not cope well. They probably develop mental health disorders during adolescence, and they have a lot of physical symptoms which are unexplained. Let's review emotional development. And temperament is one factor. Temperament can be genetic, hereditary. We called it nature. A set of inborn traits that organise the child's approach to the world. These traits typically appear at about 2 to 3 months of age. They're stable from birth and they're instrumental. They're absolutely necessary and are there in the development of the child's personality. However, as we said, then there's nurture. And nurture is our experiences. Family influences, we said, very important. Economic level and educational opportunities. Look, if you've got money, if you've got access to education, these will interact and change your infant's, child's initial temperament. They can have an effect. So, temperament then is the infant or child's ability or behavioural style, and it's determined by how they react to situations, and it expresses and regulates their emotions. Characteristics include activity level, distractibility, adaptability, sensitivity, and look, their mood quality. So when we look at nature, or is it nurture? Is it nature or nurture? Well, let's look at nurture. Nurture are the environmental variables and situations, experiences. How we were raised. Social interactions, family, home, school, work, cultural influence, language, religious factors. That's nurture. They can be good. They can be bad. They can be positive. They can be negative. So what's temperament? Look at the images. Temperament is the infant or child's behavioural style. It's determined how they react to situations, how they express or regulate their emotions. Yep. The 9 characteristics of temperament include the following. Activity level. How active is the baby? Rhythmicity. Do they sleep, wake, have feeding routines? Distractibility. How easily are they distracted from what they're doing? Approach and withdrawal. Response to new experiences. Adaptability. How do they adapt to new situations? Attention span and persistence. Persistence with challenges. Intensity of reaction. Intensity of responses and emotions. Sensitivity. Sensitivity to flavours, textures, noises. Quality of mood. A happy, positive mood or an unpleasant, negative mood most of the time. Psychiatrists Alexander Thomas and Stella Chess in 1977, they basically described temperament as individual styles, or the how of behaviour. The personal characteristics can be seen when children, for example, are playing with friends, doing their homework, watching television. Everyone recognises children who are always active, on the go, as compared to others who move slow at a deliberate pace. I call them slugs, sloths. I'd rather have an active child than a slug. We also know children who are overly intense, who have a short fuse or temper. They're easily irritated or upset. Still, there are lots of other children who are shy, uneasy in new situations, unhappy or shy or scared with new people. Characteristics of temperament. Look at the images. Wow. What are some of the types of temperament? Well, some of the types of temperament include easy, flexible children. 40% of infants and children have an easy temperament, meaning that they're readily approachable. They adapt to new situations. They react mildly to things. They're regular in their sleep and wake and eating routines, and they have a positive overall mood. These infants or children make their parents feel as if they're doing a great job. Look at the images. Easy and flexible, adaptable, positive, interested in new experiences, get along well with others, are outgoing and friendly. Then you've got the slow to warm up, fearful children, which typically are about 15%. And these children are characteristically withdrawn, negative, especially when faced with new situations and new people. They're initially slow to adapt to change, but given time, they usually adapt reasonably well. Then you've got the difficult, nice term, spirited or feisty children. And they tend to be intense, low in adaptability, have a negative mood most of the time, as well as in their responses to newness. If they have a difficult temperament, it basically means that they withdraw from or are slow to adapt to new situations. They are very, very intense in their reactions or their responses. they have irregular routines, and they're in a negative mood. They tend to have long and frequent crying episodes. The parents of difficult babies, infants, children may question their childcare abilities and wonder what they're doing wrong. The term difficult often has a negative connotation as it overlooks what is often valuable behavioural traits. So again, if they're difficult, it could be seen as being assertive. Remember what we discussed in an earlier session here, changing positive to negative, strengths to weaknesses. It's a way that you interpret it. So these strengths or these behavioural traits could be seen as being assertive, persistent, decisive. Other words such as spirited or feisty have been suggested because they sound more positive. However, the word difficult is used because it's an established term in the scientific literature. Then you've got another type of temperament, other, no single category, and this typically involves about 35%. And these kids have got a variety of traits and can't be classified easily into the other three categories. Look at the images. Okay, and this is just a temperament chart which you can review at your leisure. You've got the three categories again: easy, slow to warm up, difficult. Easy, we said, was about 40%. Slow to warm up, I think, was 15%. Difficult, 10%. And then you've got the other, which is a combination of all of them. Then you've got 5, the aesthetic or the artistic development. And in an aesthetic or artistic or nice environment, such as visual arts, aesthetic education, which involves activities for high quality art, early art and aesthetic experiences provide a nice environment in which children learn to appreciate beautiful things, to express themselves, to develop their creativity and use their imagination. So in this form of development, they're connected with beauty, the study of beauty, and it can stimulate their senses. And a stimulating environment enhances the child's learning and thinking ability. However, there are other factors that can affect the infant or the child's development. Apart from social and culture, parenting, parental behaviours, environment, nutrition, and these include, yes, parental behaviours such as alcohol consumption, smoking. So let's look at maternal prenatal factors. Maternal exposure to teratogens. What's a teratogen? Well, a teratogen are drugs, chemicals, even infections that can cause abnormal fetal development. And essentially there are billions of potential teratogens, but only a few scientifically have been proven to have a teratogic effect. And a teratogic effect is essentially something that can result in a baby being born with a birth defect. Some of them could be radiation, pollution, infectious diseases, which are viruses, caffeine, alcohol, cigarette, narcotics. Lots more. Human teratogens, for example, have included things like thalidomide, neoplastic drugs, androgens, progesterones, a whole lot of drugs. The list goes on and on and on. Oh, here's the list. Even more. Cigarettes, cocaine, antibiotics, torch infections. Well, what's a torch infection or syndrome? Well, torch, probably important. Torch is a syndrome that refers to infections of a developing fetus or a newborn by any group of infectious agents. TORCH is just an acronym for toxoplasmosis, O, other agents, R, rubella, C, cytomegalovirus, and H, herpes simplex. A teratogen is just an agent or factor that causes a malfunction or malformation in a developing embryo. Okay. Cigarettes. The estimated number of chemical compounds in one cigarette, more than 7,000. And 70% or 70 of these have been confirmed as being carcinogenic. People still smoke though. Evidence-based. I'm going to go back. I looked after all these types of babies in Saudi Arabia, where congenital anomalies are very high because of the interrelated marriages of very close family members. Down syndrome. They're the cutest kids and the nicest adults, and it's really sad. Fetal alcohol syndrome. Even in an Islamic culture like Saudi Arabia, they still consume alcohol, even though it's haram, it's forbidden, which can have an effect on the developing embryo and fetus. There's examples. And they're all beautiful kids, they really are. It's really sad. Fetal alcohol syndrome. Cleft palate. Cleft lip. At least it can be repaired. But typically, they're associated with other congenital anomalies. Fetal alcohol syndrome, Down syndrome. Okay. In summary then, childhood development includes the physical, intellectual, social, and emotional changes. Children grow and mature differently. We're all the same, but we're different. And it's hard to say what is normal. I prefer the term typical. That's my term. I mean, it's hard to say what is normal. Of course, they fit into certain percentiles, but typically they are at this height, not normally. Typically, they are at this weight. So this can be a time that parents and teachers recognise learning disabilities or behavioural problems in children. But they have to recognise what is essentially normal or typical. Okay, thanks again everybody. If you found this session of any value, then as I said, thanks, and check out other Dr. Manny Learnshops.